In this poster, we aimed to characterize a cohort of breast cancer patients with brain metastases, and in particular to molecularly characterize using next-generation sequencing tissue from the brain mets. So our aim was to identify the presence of clinically actionable alterations according to the ESMO Scale in the brain mets. And in particular, we observed a quite high, more than 60% of brain mets had a clinically actionable alteration, class 1 or 2. And in particular, we had a high rate of alterations in HRD pathway, in particular BRCA1, BRCA2, and PALB2 mutations. We were not able to sort out germline from somatic mutations. And we also had a quite high prevalence of alterations in the PIK3CA and PTEN pathway, mainly deletions or mutations in PTEN. In addition to this, we also assessed the prognostic values of these alterations, and specifically in the HER2-positive breast cancer brain metastases, we observed that the presence of PIK3CA mutations, in fact, were linked to a worse prognosis, so a worse overall survival from time of breast cancer brain metastatic diagnosis. We observed that the study was not aimed to detect, in fact, the differences between subtypes. We had quite a small number of breast cancer brain metastases, 56. Anyway, this is one of the largest cohorts characterized today. We observed that, as expected, we had a higher rate of HRD alterations, so BRCA1 and BRCA2 alterations in triple-negative breast cancer, while we had a lower rate in homo-receptor positive HER2-negative breast cancer and a substantially lower rate in HER2-positive breast cancer. Anyway, I want to highlight that even in the homo-receptor positive HER2-negative breast cancer brain metastasis cohort, we had almost a 20% rate of HRD alterations. As for what concerned the PIK3CA PTEN alteration, these were more substantially distributed across all three subtypes.